Okay, I know we will still have people joining us, but I'm going to get us started as we have an hour this morning and a panel of distinguished guests who are going to give us an overview and update on the international community here at Columbia and vaccine updates. And let me just take a few moments and introduce myself. My name is Julie Kornfeld, the Vice Provost for Academic Programs here at Columbia University. And on behalf of the Columbia Global Center, is really happy to welcome you all here today. Joining me this morning is Dr. Wafaa El-Sadr, University Professor of Epidemiology and Medicine here at Columbia. Donna, Lynne, the Senior Vice President and Chief Operating Officer of Columbia University Irving Medical Center, and Melanie Bernitz, our Senior Vice President and Medical Director for Columbia Health. They will each speak for about 10 minutes, and we will then, I will say a few words about academic planning, and then we will open this up for questions. Suspect that we will have many questions, and we will do our very best to answer and route them to the most appropriate. So Dr. El-Sadr, I'm going to turn this over to you and allow you to begin this morning. Thank you for joining us.
And thank you very much, appreciate it. And good morning, good afternoon, good evening, everyone. And I'll share screen. Can see screen? Okay, great, let's get started. So the focus today is to really focus on the vaccine update for all of you. I'm going to start first, as always, with just a very brief status of the global pandemic. And as you're all well aware that the pandemic continues to grow, and with now more than 157 million cases, confirmed cases, and more than 3.2 million deaths that have been reported. And what we've noted from the beginning of the epidemic is the majority of these cases have been reported from the Americas, from North and South America, 41%, as well as 34% from the European region. And then you can see smaller percentages from other parts of the world. And then as you can see on this map here, that COVID-19, these red dots, has touched every corner of the globe and every country around the world. Now, what's happening in terms of the US and then New York City? And overall, the US has reported the largest numbers of cases globally, continues to lead the world, followed by India at this point, with more than 32 million cases that have been confirmed, COVID-19. That's 21% of the global cases, while the US represents about 4% of the global population. And at this point, more than 581,000 deaths. In the US, there have been 3 surges that you can see here in the figure on the right. And the good news is that after the last surge, which occurred over the holidays, there's been a decrease in numbers of cases. And now there's also, you can see here at the end of this curve, a substantial decrease in the numbers of daily cases. Similar, New York City has had a severe pandemic, more than 937,000 cases. And New York City experienced 2 surges, and similarly another surge over the winter holidays. And you can see the abrupt decrease that we're experiencing now in numbers of daily cases in New York City, which is really welcome news. So let's move on now to talk about COVID-19 vaccines. The good news is there's a very robust pipeline of vaccines that are in development. You can see here 49 vaccines that are in phase 1. This is very early research, first in human studies to determine whether the product is safe and determine what dose could be used of that product. Then you can see again other compounds that are in phase 2 and phase 3. And phase 3 are these very large studies that actually give us the answer as to whether a vaccine candidate is safe and effective. And you can see that several vaccines have been authorized and approved. So this is really good news in terms of vaccine development overall. I want to focus now on vaccines that have been pre-qualified for emergency use by WHO. And 3 of these have also been authorized for emergency use. That's the first 3 here by the Food and Drug Administration and recommended for use in the United States by the US Centers for Disease Control and Prevention. So let me start by the 3 that are approved, that are authorized both in the US as well as also by WHO. And they include the 2 vaccines, Pfizer-BioNTech and Moderna vaccines. They use the new messenger RNA technology. And this is a technology where the messenger RNA is injected with instructions to create for the body to elicit an immune response to one of the spike proteins of the virus itself. And studies with these two vaccines have shown that it's very highly efficacious with more than 90% efficacy, and that the side effects have been mild to moderate, and mainly with pain or swelling or tenderness at the site of injection, fatigue and headache and so on. And these side effects have been short-lived and resolved within a few days. Both of these vaccines are two-dose vaccines, day 1, day 21 for the Pfizer-BioNTech, and for Moderna, day 1 and day 28. The third vaccine that has been authorized for use in the United States uses a different technology called the virus vector. And this means that it uses a very benign, harmless cold virus to enable to provide instructions for the corona spike protein to elicit then the immune response. And overall, the efficacy has been 66%, in the US, 72% efficacy. And similarly, mild to moderate side effects. And this is what distinguishes this vaccine, is that it's the only one that's a one-dose vaccine. So that obviously has a lot of, that's a big advantage, and makes it a very convenient vaccine to use. I just want to point out that to please avoid comparing the efficacy across these different vaccines, because these studies were done in different populations, different time points, and in different epidemic contexts. So for example, these two studies were done earlier in the epidemic than this one study, and therefore the circulating virus variants differed substantially during the two periods of time. Now, in terms of two other vaccines have been authorized by the WHO, and they're not as of yet authorized by the Food and Drug Administration in the United States, or the CDC. And these include the AstraZeneca vaccine, again, uses a virus that's an adenovirus that's a benign virus, a similar technology to the Johnson & Johnson vaccine. And again, the overall vaccine efficacy is about 70%. This is the same kind of safety profile, similar safety profile, and this requires 2 doses. And then most recently, as you've heard last week, I believe, was the authorization by the WHO of the Sinopharm vaccine. And this is different. This uses an inactivated virus with an adjuvant, which is a substance that helps to stimulate the immune response. And again, studies of this vaccine have shown that it has a vaccine efficacy of 78%. And again, a very nice safety profile of the Sinopharm vaccine. And this vaccine requires 2 doses, and it's in the same schedule as the Pfizer-BioNTech, day 1 and day 21. Now, I just want to touch briefly on a rare blood clotting side effect that has been reported in the media in association, a rare event in association with 2 of the vaccines, the AstraZeneca vaccine and the Johnson & Johnson Janssen vaccine. And this is a syndrome that has been reported, which includes clotting, a combination of blood clots, as well as very low platelet counts. Platelets are a substance in the blood that enables the blood to clot. This syndrome is quite rare, and some of these clots have been observed to occur in some of the veins that drain the brain, that lie right under the skull, as you can see here in this picture. What we know is there's been enormous examination of the side effect to determine its magnitude, its importance. And based on a review of these events on April 7th, the European Medicine Agency reported there is strong association and probable causal link between the vaccine and this rare clotting event. And however, on April 23rd, the same group indicated that certainly, even though this is a very rare side effect, the benefits of the vaccine outweigh its risk in adults of all age groups. And what has happened thereafter is various countries around the world have determined ways in which this vaccine would be used. And many of the countries have restricted the use of this vaccine to older individuals, and the cutoff in different ages varies substantially from country to country, as you can see here on this slide. And the reason for this is that most of these rare side effect has been noted in younger individuals, less than the age of 50, and particularly amongst women, but not exclusively amongst women. Now, in terms of the CDC, it also reviewed the data regarding this very rare syndrome that occurred with the Johnson & Johnson Janssen vaccine. And they identified that this is quite rare, occurs at about 7 cases of this rare blood clotting event per 1 million vaccinations. And also the CDC said the same thing as the EMA, which is that the vaccines potential benefits far outweigh potential risks. And on April 23rd, the CDC also recommended that the use of this vaccine be resumed in the United States for adults 18 years and older, but they also indicated there should be information provided to the person who's getting vaccinated with the J&J vaccine in terms of this potential side effect, particularly, as I mentioned, amongst women who are between ages of 18 and 49 years of age. It's important to keep in mind that this blood clotting event has been noted to occur usually within about 2 to 3 weeks after a vaccination. So briefly, how are we doing in terms of vaccination? This map shows the vaccination rate per 100 persons, and the darker the green, the higher the vaccination rates. And you can see that some countries are doing better than others. Here, there's a lot of disparity around the world in terms of vaccine uptake. With countries like the United States doing fairly well, Chile, the UK, Israel, the United Arab Emirates, and so on, while at the same time there are other countries that have just begun, and largely most of the African continent, they've just, in the lightest green here, they've just begun to vaccinate their population. Now, an important issue has been what we call interchangeability of the COVID-19 vaccine products, and this is particularly relevant to international individuals who are in international settings. And according to the C guidance, anyone who's received a full series of a vaccine that's currently authorized for use by WHO, any of the 5 that I showed you on that slide, that these individuals, if they've received the 2 doses as required, or 1 dose for the J&J vaccine, that these individuals are considered to be fully vaccinated, and they do not need to receive any other vaccines in the United States. For example, if somebody has received 2 doses now of the Sinopharm vaccine, that means that they are fully vaccinated based on this requirement, and they don't need any additional doses by an FDA authorized vaccine. Now, however, there will be people who are partially vaccinated, like, for example, somebody who's received 1 dose of a Sinopharm or 1 dose of the AstraZeneca vaccine, or individuals who have received vaccination with a vaccine that is not authorized by WHO. And these individuals will be required to get a full series of a US food and FDA authorized COVID-19 vaccine. And this should be at a minimal interval of 28 days post the vaccination with whatever vaccine, non-FDA vaccine, authorized vaccines that they've received before. So an important website to keep an eye on is the WHO website that is being updated every day in terms of listing which vaccines have been authorized by the WHO. There are a lot of vaccines. I'm not going to go through these slides, but this slide and the next slide shows that there's several other vaccines that are in the pipeline, and therefore it's important to, again, keep an eye and see what's going to be authorized by WHO, which will have important implications for all of you who are not situated in the United States. And the recommendations, of course, is whatever vaccine you have access to please get vaccinated as soon as possible, because ultimately we want everyone to be protected from COVID-19. So in conclusions, the vaccines offer clear individual as well as public health benefits, and they all have been distinguished by preventing symptomatic COVID-19, hospitalizations, and deaths. And all of the vaccines authorized for use by the FDA and WHO offer strong protection, and they have a favorable safety profile, with the exception of this rare side effect that has been reported with both the AstraZeneca and the Johnson & Johnson vaccines. And of course, I end by saying that Columbia is committed to ensuring that all affiliates have access to COVID-19 vaccines and that it fulfills the mandate for vaccination of all students. Thank you very much, and I'll stop here and hand it back to Julie.
Excellent. Thank you very much, Wafaa. Donna, I'm going to turn things over to you. I know we have a lot of questions coming in the Q&A. I think many of them will be answered through the next two presentations if they haven't been answered already, but if not, we'll address them at the end. Please go ahead, Donna.
Mute. All right, great. Well, good morning or good afternoon or even good evening, depending on where you are. And as you heard, you're going to hear a consistent theme that you heard from Wafaa, from me, and then from Melanie, to take you to what is required, not only when you arrive, but what you ought to do before you arrive on campus, should you be able to come back and join us. And we're definitely aware that that may still be difficult because of visa and other issues. And we're clearly going to be addressing the ability for students to participate remotely in the fall. So as you heard from Wafaa, the situation in the United States has improved dramatically over a period of time from early January through the middle of February period, but then it kind of flattened out. But there has been a pretty significant change just in the last month. And that's even more dramatically true in New York City. And that's important, obviously, because part of our responsibility in the Columbia community is to keep our surrounding community safe. So the numbers have plummeted quite a bit. And I'll show you that my responsibility here at the university is also for the medical center campus, and that is also improving significantly, although we do have quite a few people still in the hospital. Manhattan has always been our strong point. This is what New York City looks, and I know many of you come back, and while many of you live in the Manhattan area, you live in the surrounding boroughs, and so the rate of positivity in those boroughs has been consistently higher than it has been in Manhattan, but again, it's dropping to numbers that I'm going to show you in a minute that are quite significant. So up here at the medical center on 168th Street, we track the number of people who are admitted to the hospital. And again, you can see that, you know, since about the 1st of April, we've had a pretty consistent and significant decline in the number of positive cases we have in the hospital. But we still do have people who are here in the hospital for fairly long periods of time and are in our ICUs. The New York State data, Wafaa showed you New York City. I'm going to show you both New York State and New York City. I take you to the second bullet under New York State. So you can see our positivity rate of 1.7% is significantly low. It takes us back to November of last year. And then the first bullet under the New York City data of 2.61 takes us back pretty much to a similar period. We were in the 1% range, though, from July through about the end of October, when we started a slow climb up to numbers, in fact, that were 7 and 8% in New York City. So focusing on the vaccine, and Wafaa went over those that are approved by the World Health Organization, but in the United States, there are only 3 that we're using: Pfizer, Moderna, and J&J. Consistent with the recommendations that Wafaa mentioned, we did suspend the usage of J&J. But if you come to our Columbia sites, and I'll mention those in a minute, we are providing actually all 3 vaccines. Melanie will get into some detail. We've been trying to make sure that for our international students who actually are here, we do a 1-dose J&J regimen. But we ourselves don't order the vaccine. We actually are reliant on the city who gets their vaccine from the state and the federal government. And our partner here at Columbia New York Presbyterian Hospital has pretty much been providing us with Pfizer. If I had to estimate a number, I'd say about 95% of the people who have gotten the vaccine, either from Columbia or from New York Presbyterian, have gotten the Pfizer vaccine, which, as you know, is a 2-dose vaccine. That's first dose followed by 3 weeks later by a second dose. But we have done some, oops, sorry about that. We have done some J&J and hope, just from a convenience point of view, to be able to do J&J. We've also been doing 16 and 17-year-olds. I know at the cusp of college entry, we have some 17-year-olds. And so the only vaccine that can be used on 17-year-olds at this point is the Pfizer vaccine. So as Wafaa said, we've been vaccinating pretty rapidly in the United States. We're almost at 57% of the population having 1 dose. And so these are significant results. In New York, we actually just recently went ahead of the United States average. We've been lagging it a little bit. So we're at about 59% of the adults in New York having gotten at least their first dose, or and you'll see in the second dose, we're at about 46% completion of the vaccine series, including Pfizer. We are doing the vaccine for Columbia affiliates and even for family members in several locations. So on the Morningside campus at Lerner Hall, and then there are, as of this week, 4 locations you can get the vaccine. 3 in Manhattan at 168th, 103rd, and 51st Street. And you can also get the vaccine in White Plains as of this week. This just gives you a little flavor of the vaccine that we've been doing. We've already done about 13,000 with NYP, but since March 15th, we started up slowly, and we'll continue to do vaccinations across all of our sites through the fall. And so we hope that many of you who come back, if you've been unable to get your vaccine in the country that you're residing in, we will be happy to give it to you. One thing we cannot do is you cannot get 1 dose in the country that you're living in and come to the United States and expect to get the second dose. So you should plan accordingly. Our strong recommendation is that you get both doses in the country that you're in. And then because we actually match in the United States, and I suspect it's being done in other countries as well, you know, the 2 doses, the second dose is set aside based on the number of first doses we do. Last thing I'll just mention and then turn it over to Melanie, because in addition to vaccine, we have a lot of safety protocols on the campus that you should be aware of as you come back if you haven't been here for the last year, and they go beyond the vaccine. So we issued back in April a mandate that all undergraduate and graduate students must be vaccinated for COVID-19 for the fall term. We'll provide that to you, and we really, again, want to make sure that you're getting that vaccine prior to coming back to the campus. But if you're staying in your country and you're fully remote, we're not requiring that you get the vaccine, although we would strongly urge that you do so. And then the last thing I'll just mention is there is an exemption process, much like we have for the flu, whereby if there are medical reasons that you cannot get the vaccine, or there are other religious reasons, we will accept those exemptions. So I'm going to stop and turn to Melanie, and then we see some questions that are popping up, and we want to get to your questions as soon as possible.
Thank you, Donna. And let me share my screen. Good morning, good afternoon, good evening, everyone. Thanks for having me here today. And I'm Melanie Bernitz. I oversee Columbia Health, which is a student health service for the students on the Morningside campus. Just to give you some broader data as well, I did want to share our campus picture. This is some data from a couple of weeks ago, but it is a lot better than even the New York City situation that you saw described. We've done a lot of COVID-19 testing on campus. We've done at this stage over 240,000 tests since last June, and our cumulative positivity rate is less than 0.38%. We also every week do a random sample of those students, faculty, and staff who are accessing campus. And as you can see, the positivity rate on our random surveillance is incredibly low, significantly below city rates. So we're continuing to monitor the campus situation, but it really is very good. The daily routines continue. We can now continue to encourage vaccination as a priority as soon as you're eligible wherever you are. And we continue to remind our community and imagine that many of these daily routines will still be in place when we come back to campus, even in the fall. Many of you have probably been doing this wherever you're located, but it's always the reminders to stay home if you're not feeling well, wearing a face covering. Some of the guidance around that is changing outdoors, but certainly indoors, we're wearing our face coverings, maintaining physical distancing. And this is really part of the commitment we've all made as part of our Columbia Health Compact to really support each other and stay safe. The daily attestation has been something we've all been doing and likely will also still be in place in the fall. This is an app that we have that allows us to answer some quick questions and to see if we're safe and get a green pass to come onto campus. It's 3 simple questions that talk about testing positive, being in close contact with someone who's test positive or having symptoms of COVID-19. And it's also where we tracked compliance with the compact, trainings, and the testing requirement. And this is where the vaccine requirement will also be added when you come back in the fall. The testing requirement is a hard block. So if you are coming back to campus over the summer, you will have a red pass until you get your first test. I do want to remind you all about the resources that we have. So many of the questions that are coming up are available, are answered on the COVID-19 website, covid19.columbia.edu. Please bookmark that site. Use that as you're planning your return to campus. There's also a chat bot there, so you can really get your questions answered. All the data we show you is available there. And so you can really see what's going on in real time by accessing that website. I also just wanted to share this so you can kind of understand the university process. Over a year ago, we set up this process, and it's still working really well, where we review the global information and then the national information we get from the CDC, and then the state, New York State guidance, New York City guidance, and ultimately how this impacts our campuses. So we're constantly looking at all these guidelines, requirements, recommendations, and using those to inform the campus response. It's been a very successful approach, so it is an approach we'll continue to use. And it's really, I think, allowed us to keep campus active and open this past year without having to go backwards on any of our restrictions or have any shelter in place. There have been a lot of changes around masking. The CDC has now changed the guidance on fully vaccinated individuals who are no longer required to wear a face covering outdoors, except in certain crowded settings. And that is important to note because in New York City, many outdoor settings are still crowded. And in certain indoor settings in your homes, we still do require the use of masks indoors on campus. But again, we are constantly watching this guidance as it changes, but we are still recommending mask use. Also worth checking the CDC site, because this is showing the different activities that are defined safe for fully vaccinated individuals. You can see on the right, fully vaccinated individuals can participate in certain activities without masking. And obviously, if you're unvaccinated, these are less safe and require masking. There's also some more guidance there, so you can see the big difference in terms of safety after vaccination. And this is one of the reasons why it is so important that we all get that as soon as we can. So just briefly, I've seen some questions coming up around what testing will look like in the fall. We have really evaluated our testing approach throughout the past year and changed it as the situation evolved. We do have 2 high throughput, volume testing centers, one on each campus, Lerner Hall at the Morningside campus and the Black Building at the CUIMC campus. We have the capacity to do over 2,500 COVID tests a day. For fall 2021, we haven't fully put in place the testing program because, as I say, we do base this on the current situation, but we anticipate that we will likely require gateway testing, which is actually re-entry testing for everyone at the start of the term. There's nothing special about that test. It just means the first test you get when you come back to campus, and more guidance will come regarding the period of time during which that test must be completed nearer the start of the fall term. This is then followed by ongoing surveillance testing. And again, as we shared, that program has been really important in monitoring the campus situation and the campus prevalence of COVID-19 and determining if we need to make any other changes. So again, the exact details of how that surveillance program will look in the fall is not yet decided. It's a little too soon because it's going to be based on so many other parameters. But we will notify you how often testing will be required based on the prevailing public health circumstances in the fall semester. Contact tracing has been going on. It's been really important in allowing us to identify cases and suppress transmission. We have an on-campus team of contact tracers who do the work as soon as we're notified about a positive test. We can get our contact tracing team involved and then notify anyone who's a close contact and needs to quarantine. We do that in close partnership with New York City Department of Health as well. And so we anticipate that this work will continue in the fall as well. So that's a bit of background, and then just going on just to reiterate again what both Donna and Wafaa have said. The vaccine availability has really changed in the last few months in the United States. It's really shifted, and we now have adequate supply, and everyone in the United States over the age of 16 is eligible to receive a vaccine. And in fact, we anticipate that being lowered to 12, hopefully this coming week. So if you are in the US, or if you're returning to the US and have had difficulty accessing vaccine, we anticipate you should have less difficulty when you arrive in the United States. After you're vaccinated, as we've shared with some of the other slides, we still anticipate following other health and safety protocols, and that many of these measures will remain in effect through the fall term. So just in terms of a little more detail on the vaccine requirement, as has been mentioned, all students are required to be vaccinated. The website contains a lot of FAQs answering many of the questions in terms of why and how. And then we anticipate in the next day or two an email coming out to all of you, to all our students, detailing exactly how to meet this requirement. So sharing with you how to upload documentation if you have been vaccinated, if you are requesting an exemption, how to access the forms for that and the process for requesting an exemption, as well as, you know, these differences in terms of what happens if you can't access a vaccine, what will happen when you come back to campus. So for our international students, as has been said, we strongly recommend you getting vaccinated wherever you are as soon as possible and not waiting till you get back here. Those authorized by the World Health Organization will be acceptable. That list is constantly changing, as Wafaa said, so keep an eye on that. And if you have not been able to access vaccine, or you've been vaccinated with a vaccine that is not acceptable, we will have a process in place to guide you in terms of what to do when you return to campus so that you can be compliant. All of that being said, I always want to remind you about the ongoing support that is available to you even now, and certainly when you come back. We have many virtual support options available through both medical, counseling, and all of our other health promotion activities. So be sure to go to the Columbia Health and the CUIMC Student Health on Haven websites so you can see what is available to you. So with that, we look forward to answering your questions. I will turn it back to Julie.
Great, thank you very much. What a great presentation. I think that many of the questions have been answered in some way, shape, or form. I'll go back through some of them that maybe need a little more clarification or reminder. I do want to say just a few words. I think you've heard this, but we are returning to campus. We will be in person as much as is possible. So as many people have asked whether or not the expectation is that they return to campus, we do understand that there are some countries where visa appointments remain difficult, and we will be working with you to accommodate those delays. If necessary, students who aren't able to get visas will be able to participate remotely in classes until they are able to return. And we are working closely across the university and across schools to ensure that that planning is in place. So if you aren't able to return and there are significant delays, we are aware of those. Our International Student Office is monitoring them very closely, and I know working very closely with you as individual students. And we will be working to ensure that you have access to classes. That's different than a medical exemption for the vaccine, for example. That's a different process. So just to be clear that there will be accommodation processes for students who need to participate remotely, really for the reasons because they're not able to return because of visa situations. Other than that, the expectation is that students will return to campus and participate, and we're really looking forward to, as much as possible, a return to campus in as many ways as possible. We await, I think as Melanie outlined, we are subject to CDC and New York State guidelines, and so in terms of gatherings and in terms of ability to meet in classrooms, we are waiting and updating our recommendations and our planning as we learn more from particularly New York State as terms of what will be allowable in classrooms and on campus and in-person gatherings. But we are planning for multiple different scenarios, and our intention is to return to an in-campus as much as possible. And some of that will vary by school, and your schools will be in contact with you directly about expectations in terms of exactly which classes will be held and where. But again, we really are planning to be in person, and we are requiring students to be vaccinated. So that is our plan. And as Melanie stated, we will continually update that plan as the public health conditions continue to change and improve, hopefully, and also as we receive additional guidance from the state and from the CDC. So I'll stop there. I know we have many, many questions. I think one of the questions I see asked over and over again in a variety of different formats is countries where students are worried that they will be delayed in getting the second dose. I know, Donna, we mentioned that we are urging people to get both doses before they return, but I see a lot of questions in countries where the second dose is being significantly delayed and worrying about timing. And so, Wafaa, do you want to address that?
Yes, and yes, I appreciate that this is a situation. And as you saw in one of my last slides, is that if you have received one dose of those vaccines that are either approved here in the U.S. or authorized by WHO, then we will then need to give you a full series of vaccination when you come to this country. Because that's considered like only one dose. Remember that you will need to get a full dose here for two reasons. One, you've received the vaccine that's not authorized. And I saw one of the questions was about the Bharat vaccine, which is not on the WHO list. And then the other situation, if you only received one dose, you have to essentially get a full series when you come to this country.
Wafaa, can I maybe, I'm gonna try to be a mind reader though. Should anybody worry about 3 doses or even 4 doses of a vaccine?
I think I don't think one should. I mean, I think in a lot of ways, what there has always been this anticipation that there may be the need for booster doses, and there's studies ongoing now to look at actually the effect of booster doses of vaccines. In all likelihood, people might have a boosting in their immune response, but it's unlikely that they will have a severer kind of an immediate side effect. So that's what we anticipate. And I think that's the reason that the recommendation is to wait 28 days since that last dose has been received. We can't hear you.
Sorry. Yeah, I'm sorry about that. I think maybe a lot of the questions I'm also seeing around quarantining and what happens when students arrive on campus. I know you touched upon that, Melanie. Maybe you could address that a little bit more in detail.
So it's hard to predict what the quarantine requirements will be because this has been a very rapidly moving target. Right now, today, if you're arriving in New York from an international destination, you are not required to quarantine. If you arrive in a different state, there may be different requirements. So it's really, you've got to check back depending on where you're arriving and when. So right now we're following the New York State guidance. Any student arriving today does not have to quarantine coming from an international destination, but we certainly recommend that they can if they wish, and testing is available. So we certainly recommend testing again after arrival. How that's going to look in the fall, again, we will publish the guidance as it becomes available from New York State. But I see some of the questions have also been around, well, if I haven't been vaccinated, am I going to have a different quarantine requirement to those who have been vaccinated? Right now, that is not the case. I would say that we certainly anticipate the potential for a different testing requirement for those who are not vaccinated compared to those who are. Again, the exact details we just don't have yet because it's a little too far in advance to predict. And similarly, there were questions about, well, will I be able to move into my housing if I'm only partially vaccinated or unvaccinated? Yes, absolutely. We're not going to restrict you access to any of those required living facilities based on your vaccination status, but we will make sure you know how to then expedite that vaccination process. And I think one of the other things, just to add to that, is if you're in the midst of vaccination or unvaccinated because you haven't been able to access it, what other restrictions will be in place. Again, similar to what I showed you with the CDC guidance, there may be different kinds of restrictions on your activities until you are fully vaccinated. So more to come on that as it becomes clearer.
Okay, great. And I do see several different questions about arrival on campus for classes, et cetera, and if people are delayed. And so I just want to say that, you know, obviously, you're going to have to work individually, both if you have visa questions or I-20 questions, you should contact the International Students Office. They're working very hard to accommodate and answer all of those questions. If you are worried about being delayed, you need to also let the office know and your school know, because we will be able to accommodate students if they are delayed in their arrival here because of visa appointments, et cetera. And we know that, and we're preparing for that. And we will be able to have students who are able to access their courses online until such time that they can return here. So please, you know, keep in touch, and we will be updating and communicating to you as we learn more and more. We're very hopeful. We're hearing positive signs, particularly in China, that more visa appointments are becoming more and more available. And so we're very hopeful that those things will continue to be expedited, but we understand that some students will experience delays, and those will be accommodated for the schools. Again, those are, you know, accommodations because of delays in visa. Otherwise, the expectation is that you will return to campus and attend school. And if there was a question, I also noted about a deferral, and I would encourage you to go to your individual school. Those decisions are made at the school level.
Julie, could I add something in
Sure.
about classes? I've noticed a lot of questions about, are our classes going to be in person? And while the intent is that the classes are going to be in person, in New York, and actually in the entire United States, we have a requirement that you probably have heard about, and it's called 6-foot distancing. And 6-foot distancing is not in one direction. It's actually in all directions. And you may have seen at one point, I can't remember the country, but people were wearing very large inner tubes to affect what 6-foot distancing means. And so you can imagine in a classroom that 6-foot distancing is pretty hard to accomplish. The governor recently eliminated another rule that we had, which was around occupancy. So if a room had 100 person occupancy, we were only allowed to use 50. We're now allowed to go to 100, but the 6-foot distancing rule is still in place, which means that it is very hard to get the number of students in a classroom that we previously were able to do. Now we're working to try to change that so that by the fall, we will either not have that kind of distancing, or we may have no distancing, again, depending on the fact, relating to the fact that everybody's going to be vaccinated or be going to additional testing and required to wear a face covering in the class. But I noticed a number of questions about Are we going to be 100% in the classroom? We hope we are. We're working towards that. But the remote option that I know many of you who are international students who might not be able to get here could very much be part of the reality, or something that we call hybrid, which is, you know, for example, you may be in person 1 week and half of your class be remote, and then you flip that around. There'll be a bunch of variations around that if we don't get the 6-foot distancing cleared up.
Yes, thanks, Donna. I think, and that will vary a bit by school too, because everybody has different facilities and classroom facilities of sizes. And so each school is working in multiple scenarios, just as Donna described, based on changing recommendations and realities on campus. I'm seeing a lot of questions about other vaccinations, flu, meningitis, MMRW, and I'm wondering, Melanie or Wafaa, if you want to comment on requirements and expectations there.
In terms of the university requirements, MMR, measles, mumps, rubella, is a requirement for attendance any university in New York State. That is a state requirement. It's important to plan ahead, because with COVID vaccines, you're not allowed to get any other vaccines within 14 days of those. So if you need both your MMR and your COVID series, you need to kind of plan the timing so that one doesn't block you out of the other. But the MMR and the COVID are the requirements for the fall. We did have a flu vaccine requirement this past year, and that will likely also be in place next year, but the flu season is different. So you don't need to worry. Right now, flu season is over. So if you didn't get a flu vaccine, you don't need one to come back to school in August or September, but you will need to get one later on in the semester. We usually start giving those out in September, and that requirement will come in place likely by late November, which is when flu season really kicks off. So the ones to worry about right now are your COVID vaccine and your MMR requirement, and flu will be made available to you on campus when the timing is right.
Melanie, along those lines, I see a question about family members of international students being eligible to get vaccine. Can you comment on that?
Sure. The Learner Hall site is only available to Columbia students, faculty, and staff, but the other Columbia sites that Donna mentioned are available for anyone. So family members can register and get vaccinated at any of those sites. And there are sites close to campus if you are living downtown, and for those who are uptown, available there as well.
And there's no cost to having them get the vaccine, and there's a registration process that's on our website that you can use once you arrive in the country. But if the supply, as we expect, continues to be where it is, it should absolutely be no problem getting them done here on 168th Street or even on 103rd and Broadway at our primary care location.
Melanie, will international students be able to book their vaccinations on campus prior to arriving on campus, and even before they get an ID, even?
Yeah, so it's linked to the Columbia Health portal. So once you have a uni, you can log in. The appointment scheduling only opens a day or two in advance because it's based on our vaccine supply, which, as Donna mentioned, we're reliant on the city and we don't really know what we're getting till right before we get it. So if you're right now looking for an appointment in August and you don't see anything, don't worry, it's because it's not up there. Right now, the schedule's open for I think Monday, Tuesday, and Wednesday of this week. But we'll make sure that we, as much supply as we get, we'll open up those appointments, and we'll certainly send messaging to students. But really check a few days in advance. The Columbia Doctor sites, I think, open about a week in advance, right, Donna? Right.
Yeah. Knowing that students are coming back in September as well, we'll gear up, in August to anticipate more demand than we currently will have probably through a good portion of the summer.
And we've become really good. And those of you who've been here before know that we can do mass vaccination sites and get hundreds of people through in one day. So we'll be ready to be able to vaccinate those who need it when they come back.
I see a question, and I know this is a bit on people's mind, about vaccinated individuals who might still get infected and spread virus. And I know because of all the safety mechanisms that we've already put in place to keep the campus safe. I thought, Melanie, maybe you want to talk a little bit about that. And I know you mentioned that testing and regular testing will continue to be updated based on conditions in the city and on campus, but perhaps you could address that a bit too.
Sure, and certainly I know Wafaa will jump in with kind of the science behind all of this, but no vaccine is 100%, and you hear what they're calling now breakthrough infection, so people who are fully vaccinated getting infected. What the vaccines do are prevent severe disease, hospitalization, and death. But like with flu, you can still get the flu having had a vaccine. So that's why we continue to monitor and track. It also seems that those who are vaccinated who may get infections are much less likely to transmit to other people, which is also really good news. But we will continue to test. We will continue to provide support to those who test positive, for those who've been living on campus. Undergraduates, we have an isolation dorm. For our graduate students who test positive and cannot isolate safely in their current residence, we do move them to a different place for isolation, and then provide the ongoing medical support during that isolation period. Wafaa with.
To add, I know somebody expressed a concern in the questions about that the numbers of new cases in the US remain high. I think it's important to keep in mind that throughout the last several weeks, several months, even when there's been even a much higher surge in the US, we've been able to maintain a very safe campus with thousands of people coming to campus every day. So even that's in the era even before having vaccines available. So we will take all precautions. We'll continue to take all precautions as needed, both through masking as needed, distancing as needed, as well as, of course, testing schedules as appropriate. So to maintain a safe campus. So just to reassure people who are concerned about coming back to New York and coming back to campus.
Great, thank you, Wafaa. I noticed a question or two around people who've had COVID or are recovering from COVID and kind of their vaccine planning, and I'm wondering if you might comment on that as well.
Get vaccinated. I mean, I think there's the recommendation is for people, whether or not you've had COVID, obviously you have to be over the acute phase when you're sick and so on. Once you've recovered, then the recommendation is to get vaccinated as quickly as possible, because the data have shown that the protective response of your immune system is much better after vaccination than after a natural infection with COVID.
Right, so we shouldn't delay.
Yeah.
I do see some questions about specific programs at the law school, the LLM course, and I really would encourage, we're not going to get into specific questions here around academic programs, and please do reach out to the individual schools. I think that's the best way to get those questions answered. I also note there's some questions about some of the advocacy that Columbia has done on urging the Secretary of State to open up visa interviews. I don't know that we continue to do that advocacy, and we continue to monitor that. It's very important to us. We've partnered with New York universities across the state as well as across the nation to encourage the State Department to open visas. It's very important to us to have our international students return. So that advocacy does continue. Looking through to see if there are other, I know there's many questions. I think questions around quarantine, I think, have been addressed for the most part. I think some concerns about flying internationally. I think, Melanie, you've reiterated that right now there are no restrictions in New York State, but that does depend on when one arrives, what state one arrives into. And I think really, as Melanie mentioned, please monitor the website here. Our FAQs are updated regularly as information from the state and from the CDC informs us. And we update our regulations here on campus, or our policies here on campus based on those things. So continue to do that. We will hold these, several more of these over the summer, because information is changing rapidly, and we want to make sure that your questions are answered, and that we are able to provide as much information and alleviate some of your concerns about return to campus and the processes and procedures we have here in place. I'm looking just to see, I'll ask my panelists if there are questions that I have not pulled out that you see that you might want to jump in and comment on, Donna.
Yeah, Julie, I mean, I think one thing to reassure the participants, and you saw that data from Melanie, is how safe the campus is. I mean, and I don't want to say the city isn't safe. The city's safe. We all ride the subway. We all use face coverings. I would say that the adherence with face coverings is very strong. It's being loosened, as you saw with the CDC chart, but only in very, very limited ways. We have gathering size limits at the university. The dining so far is grab and go. And I know one of the questions was about, moving into residence halls. There's no extra requirements other than what we've said, which is you would be wearing a face covering, you would be doing 6-foot distancing. We have 2,000 up until, commencement. We had about 1,800 undergraduate students living in university housing. And, we have a monitoring system as well where student non-compliance is reported, and there's actually, diseducation, and then for repeated violations, disciplinary processes. So we take it very seriously. And we all sign a compact that requires us as residents of the community at large to, speak to our fellow either classmates or faculty and staff when we see them wearing their face covering, under their chin. So I just would say to you, if you've been in another place and you're reading about the United States, or you're seeing pictures of people on a beach or in a bar, that's not what the campus looks like, and we'll continue to reinforce compliance, and quite frankly, at an even higher rate than you see in the general community.
And then I would just add that I see there's a lot of concern about access to vaccines and coming to the US and being blocked from campus. We understand for our international students, the access is very different than for our domestic students. So we will certainly not be blocking you from campus if you have not been able to get your vaccine, but certainly encouraging and requiring you to do it as soon as you arrive and not delaying it any further.
Yeah, and I would just, remind we're in May, and we understand that there's still a lot of, process questions that folks have, and we will continually be communicating to you about how what things will look like and how you get appointments and how you will be able to access vaccine and safely return to campus. And that's our intention, to continually communicate. I do see some questions about whether or not the semester will be fully online and how that will be communicated. I really encourage you to contact ISSO. They can provide you documentation on what the semester and the academic year will look like here at Columbia if you need that documentation to take to your visa appointment. So those letters can be provided. We have announced a return to campus, as Donna's mentioned. We're doing our best to ensure as much of an in-person experience as we can. It's dependent upon some of the density requirements and the distancing requirements. And as those get updated, our plans will continue to get updated. But there will be in-person experiences here, and that has been stated by the president, and we're working very hard to return as many of you to the classrooms as we can, understanding that we will have to accommodate some of you that can't return or will be delayed in returning. So we will continue to have these forums so that we can update you and provide you additional information about your health and about a safe return to campus. It's our primary goal. These three panelists are working on nothing else but that from morning until night every day. We will continue to work towards a really healthy and safe return to campus. So thank you, everybody. This webinar is recorded. It will be posted on the Columbia Global Center website, and you'll be able to see it probably within a week or so. So thank you all for your attendance and your interest, and thank you very much to the panelists for your informative presentations and your answers to questions. Thank you.
Thank you. Thanks, everybody.
Bye.
Bye-bye.
Bye.